So I've seen a bunch of videos talking about some external visual signs as the indications of chronic kidney disease. Unfortunately, the reality is that if we are relying on checking the mirror to see if we have puffy eyes or looking into the toilet bowl to see if our urine is foamy to determine the health of our kidneys, we are actually falling into a deadly trap. By the time we can detect some external signs about kidney disease, such as the puffy eyes or foamy urine, the windows for reversing that damage has already been slammed shut and it's usually too late. That's because kidneys are really sort of master compensator that can function normally even if 50% of the kidney is already irreversibly damaged. So again, waiting for the external sign to manifest to determine the health of our kidney is really a bad idea. So can we actually see signs of chronic kidney disease from the outside by looking in a mirror or a toilet bowl? Sure, in more advanced stages. But even then, we need to be very careful and put those signs into context. For example, the puffy eyes that many people talk about could be chronic kidney disease, yeah. But one could also have puffy eyes because of allergies or just having a bad night's sleep. What about a foamy urine? Sure, it could be sign of protein in the urine, but it could also be due to dehydration or having a high protein meal. Now, what about the itchy skin? Again, lots of people get hung up on that, but your kidney must be really severely damaged to see that. It's generally one of those things we tend to see in people who are already on dialysis. A more reasonable explanation for itchy skin would be dry skin because of the dry air during winter months, right? So really, unless you have a clinical context for these signs, such as history of high blood pressure or diabetes, these symptoms shouldn't be the first thing on your mind when thinking about your kidneys. But again, if you do have hypertension or diabetes, yeah, that changes the picture. It's something to think about. Now, let's talk about the different stages of kidney disease. There are 5 stages, with the 5th stage being the most severe. Now, stage 1 and 2 are what we call the hidden decade. This is where the glomerular filtration rate, abbreviated as a GFR, it's the rate at which kidney filters the blood and produces urine. At that time, it's still relatively normal. Here the kidneys are under fire and the nephrons, which are the individual small filters within the kidneys, and we have millions of them, these nephrons are being damaged, but we generally still feel great. At this stage, there is really nothing we can see on the outside that would clearly point to significant kidney damage. This is also the stage where kidney damage is highly reversible if we catch it and take action. Now, the stage 3 is where the glomerular filtration rate falls anywhere between 30 and 59. Now, this is the tipping point. This is where we first start seeing puffy eyes or foam in the urine because the filters, again the nephrons, right, are now starting to leak protein into the urine. This is pretty much the last chance we have to sort of freeze or to stop the progression of kidney disease before the damage to our kidneys become permanent. Stage 4 is where the glomerular filtration falls anywhere between 15 and 29. Here is where we really start seeing more external signs telling us that something is wrong with our kidneys. Now we start seeing things like swollen feet, which in medical terms we call pitting edema. Basically, you press on the skin of your legs and you will see a dimple that stays there for a bit before the skin returns back to normal. But again, there are many other reasons why people get swollen legs that are much more common in the general population. Things like chronic venous insufficiency, aka varicose veins. Many women get swollen legs at the end of the day after being on their feet the whole day, especially if the swelling is completely gone in the morning before they get out of the bed. But again, I don't want to detract from our main discussion, so I will not be discussing more reasons for swelling of the legs, but there are many, many other ones. Another thing we see in this fourth stage and the fifth stage of kidney disease is pale skin, and some people will start feeling constantly tired. Now, this is because kidneys are involved in red blood cell production, and as the kidney function declines, people become anemic. But again, there are other more common reasons why someone can become anemic. Women of reproductive age, for example, are more prone to anemia due to their menstrual cycle. In men, however, this is a much more serious issue because men are generally not supposed to be anemic. When man develops anemia, there has to be done some serious investigation as to why. Now, all I'm saying is that at this more advanced stage of chronic kidney disease, the kidneys are progressively losing their ability to manage fluids and hormones the way they normally would. When we get to stage 5, the most severe stage, the glomerular filtration actually drops below 15. We refer to this stage as the end stage. And this is where we start seeing the bad breath, easy bruising, and declining urine output, among other things. This stage is way past anything reversible. We are only trying basically to delay the inevitable, dialysis or kidney transplant. This is where most people start having conversation with their provider about dialysis or getting a shunt placed so that it's ready when the time comes. So how do we move beyond this trap and shift from looking into the mirror for late-stage cues to actually managing the metabolic load? Now, there are many opinions out there about the role of protein in our diet. Some say we should avoid high-protein diets because they damage our kidneys, period. Well, the reality is that when the kidneys are healthy, they can handle decent amount of protein. Now, having a very high protein diet is, at least in my personal opinion, based on lots of research that I looked at, not good for us for many other reasons, such as the activation of the mTOR, which many people are talking about these days, since mTOR is involved in accelerating the aging process. But when we are talking strictly about the kidney's ability to handle protein, healthy kidneys can generally handle quite a bit of protein. However, for someone whose kidney function is declining, say someone at stage 3, that's where I agree with the recommendation to decrease the protein intake or at least keep it at the very close to the recommended daily amount. Now, unfortunately, most folks go way above this amount given our 16 ounces steak portions, and overall high meat consumption in our society. Protein is very much almost in everything on top of that. But the quality of protein differs. There's a difference between animal protein, which contains all the brain chain amino acids, and plant-based protein, where these brain chain amino acids are present in much smaller amount. Now, I'm not going to dive into the discussion of which is better, animal protein versus plant protein, because there are many opinions on that. But regardless, stage 3 chronic kidney disease is where you really want to start paying attention to total daily protein consumption. Now, what else can we do besides moderating protein intake? And here I'm basically talking about the big guns. So one of the biggest things we need to look at is the two main reasons why kidneys get damaged to begin with: high blood sugar and high blood pressure. In practical terms, if you are in your 40s and are overweight or obese, has your primary care provider checked if you have diabetes or if you are pre-diabetic? This is as simple as drawing a lab called hemoglobin A1C at least once a year if you are in a risk category. Now, high blood pressure is another big one. It's very low-hanging fruit, what I call. You should get it checked every time you see a healthcare provider, period. But a much more proactive way is to purchase an inexpensive over-the-counter blood pressure machine and track your blood pressure at home. Now, how do you know if your machine is accurate though? I always tell my patients to calibrate their home machines. Now, what does that mean? Basically, you take your home blood pressure machine to your appointment and have the staff measure your blood pressure first with their professional machine, and then a few minutes later, you use your machine. Now, you compare the readings. If they are quite different, then I would say return your machine that you bought because it's a piece of junk. Now, if they are close, if the readings are close to what you get on your machine and what your provider gets on their machine, you know that you can trust your home readings. Now, this also helps to rule out what's called the white coat syndrome, where basically your blood pressure spikes only because you are at the doctor's office. Now, many doctors, unfortunately, brush this off, but tracking your blood pressure at home is really the best way to know for sure if this is your case, because what if your blood pressure is elevated also at home? Unless you measure that, you will be relying on, I'm just nervous at the doctor's office. I never recommend people to go by that because it's a missed opportunity. Now, making sure our blood pressure stays within normal range long term is really one of the best ways to protect our kidneys. Now remember, damage doesn't happen over a week or even month. It takes years of continuously elevated blood pressure to literally blow out those delicate filters in our kidneys. Now, one of the easiest ways to keep your blood pressure low is by controlling the amount of salt in your diet. Now, I see it all the time, people grabbing the salt shaker and hitting their food before they even take a single bite of the food. But here is the reality. The shaker isn't actually the main culprit. It only accounts for about 10% of our total salt intake. The real salt traps is the processed and especially the ultra-processed food that make up the bulk of the modern diet. Now we are talking about the salty six, the things like breads and rolls, cold cuts, cured meats, pizza, poultry. Why poultry? Well, because it's usually injected with sodium brine to make it heavier, right? Now, another things are things like canned soups and, of course, the fast food sandwiches. Now, these are the sources of salt that are quietly overloading your system every single day. Now, does cutting salt actually move the needle? Well, based on studies, absolutely. The evidence from the so-called DASH, dietary approach to stop hypertension trials, and variety of other meta-analyses show that by significantly reducing your sodium intake and aiming for about 1500 to about 2300 of sodium intake for a day, you can really see a drop of your systolic blood pressure, the number that's higher when we take the blood pressure reading, by almost 5 to 8 digits. Now, in some patients, that's equivalent to the effect of the first-line blood pressure medication, which I think is pretty impressive. And it's just simple cutting down your salt intake. Now, who can benefit the most from cutting salt in our diet? Well, it helps everyone, but particularly it's effective for those who we call salt-sensitive individuals. This includes people with existing hypertension, the elderly, and especially African Americans. Now, research consistently shows that African American population, on top of that, tends to have much more pronounced blood pressure response to sodium reduction, most likely due to the genetic factors that cause their kidneys to retain more salt. So, if you fall into one of these categories, managing your salt intake isn't just a good idea, but it's really critical clinical intervention to save your kidneys. And always make sure that this is one of the things that I discuss with my patients, because it is, while it's may sound hard to do, it's actually very easy, because the most important thing is to start focusing on real food, just getting rid of the junk, not buying the ultra processed foods, which are not good for our body anyways, for many other reasons, and our blood pressure being one of them. So lastly, are there other things that we can do? Sure. Having adequate level of vitamin D and magnesium has been shown to protect our kidneys, but would I hang my head on that using the supplements alone? Absolutely not. I would rather focus on the big guns, the blood pressure and the blood sugar. But even simple things like getting enough sleep and preventing chronic sleep deprivation makes blood sugar control much easier, since chronic sleep deprivation has been shown to make blood sugar control much more difficult. And again, having elevated blood sugar, be it being diabetic or pre-diabetic, in the long run has negative impact on our kidneys. Now, on a practical level, the first thing is to know where you stand. You can check your blood pressure at home, but to see how your kidneys are actually functioning, you need to do some basic labs. Now, during your annual visit, you can ask your doc to check your glomerular filtration rate, the GFR, especially if you are over 40 or have hypertension or diabetes. But another common lab is checking creatinine level. But it's not really the best value to judge the kidney function alone, because there are so many factors that can affect your level of creatinine. For example, a very muscular person can have elevated creatinine simply because they have large muscle mass, while their kidney function is perfectly fine. On the other hand, you can have a person with a small frame that might have normal creatinine, even though their kidney function is declining. So, much better test is something called urine albumin to creatinine ratio, which is the gold standard for detecting early kidney function decline. This test basically can detect protein leaking into the urine years before that protein creates the foam in a toilet that some folks are saying we should be looking for. Now, unfortunately, many providers do not check this consistently. So if you are at that risk category and the age group, this is something that you may want to have conversation with your provider if he or she did not already check that and is not checking it for you. So to sum it up, do not wait for the external signs to tell you that your kidney function is going south. Focus on the big guns. Look at hypertension, blood sugar control, and I think you'll be in much better shape.